magandang umaga sa lahat. Ang papiyong ko si Dr. Sana Barba-Cabodil. Salamat sa panibagong araw na muli tayo ay makakapag-usap-usap tungkol sa pangkalusugan. But before anything else, we would like to invite you to follow and subscribe our social media accounts. Please like and follow our Facebook page at www.facebook.com/DoctorsOnTV and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions po and comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong family and mga friends. Alam niyo ba mga kasambahay, noong 19th century, ang ectopic pregnancy ay kilalang universally fatal accident sa pag-uulat po ng matagumpay na paggamot na tubal pregnancy gamit ang salpingectomy noong 1884 ni Robert Lawson Tate. Nagsimula po ng halos 70 years of exclusively extirpative treatment ng ectopic pregnancy. Kaya po noong ika-20th century ay nag-improve po sa kakayahan ng pag-diagnose upang maging posible at kahit ang diagnosis po ng unruptured ectopic pregnancy ay possible na pong magawa.
Hindi maiwasan na may ilang kaso ng mga panganganak nang mayroong komplikasyon. Isa na dito ang tinatawag na ectopic pregnancy o pagbubuntis sa labas ng matres. Ang mga unang sinyalas ng ectopic pregnancy ay katulad ng mga sintomas ng healthy early pregnancy. Ngunit ang ectopic pregnancy ay magpapatuloy ng ilang linggo. Makakaranas ito ng matinding sakit sa tiyan o pelvic at pagkahilo. Ayon sa datos, nasa 1 hanggang 2% ang overall rate ng ectopic pregnancy sa general population.
It's very good to know about this information. Ako, lalo na po sa mga nagbabalak magbuntis. Marami pang dapat abangan mga kasambahay, kaya ako stay tuned lamang. Doctors on TV will be right back. Now, mga kasambahay, sit tight, grab your coffee, and prepare to learn a lot about ectopic pregnancy. And as we delve into our discussion, our guest saving knowledge and expertise will help us to learn about this condition. And let's welcome Dr. KATRINA Tan. She is an obstetrics and gynecologist from Makati Medical Center. Hi, Doc Kat. Welcome to Doctors on TV.
Hi, good morning, Doc Sarah. Magandang umaga din sa ating mga kasambahay.
Yes, and thank you, Dr. ha, kasi you're sharing your time and mas marami tayong matutulungan po sa ating pag-uusapan ngayong araw. Okay, but before we proceed any further, mga kasambahay, let's watch this and learn about what ectopic pregnancy is.
Ang ectopic pregnancy ay nangyayari kapag ang fertilized egg ay nag-develop sa labas ng uterus. Hindi ito maaaring magpatuloy sa pagkaki at nagiging panganib ito para sa kalusugan ng babae dahil maaaring magdulot ng komplikasyon tulad ng pagdurugo at rupture ng fallopian tube.
Get ready to learn mga kasambahay. It's sure to be an enlightening and informative conversation that you won't want to miss. So to learn from one of our experts here with us, Dr. KATRINA Tan, to discuss more the details. Okay, so Doktora, ito when we say ectopic pregnancy, what exactly happens po kapag sa isang pasyente na buntis?
Okay, an ectopic pregnancy is when a fertilized egg implants outside of the uterus, which is the normal implantation site for pregnancy. Okay, so simply, ito ay pagbubuntis na kumapit outside of the uterus.
Kasi dapat talaga doon sa loob ng matres.
Yes.
Now, kapag hindi doon nagkaroon ng implantation, hindi doon, nandun yung fertilized embryo. Okay, so basically, hindi, yung tawag po doon ectopic pregnancy.
Yes.
Okay, and usually, Doktora, saan yung mga ibang size na pwede?
Okay, because in a normal conception, what happens is the egg is fertilized by the sperm inside the fallopian tube. Now, after it's fertilized, the fertilized egg travels the length of the fallopian tube, and in 3 to 4 days, it will implant inside the uterus. Now, for example, you have a blocked fallopian tube. Okay, this does not happen. The embryo cannot pass through. So what happens is that it implants in the lining of the fallopian tube, or it can go somewhere else outside of the fallopian tube and implant to the ovary. Okay, or out inside the abdominal cavity. Also, there are cases wherein it implants inside the uterus pero sa abnormal na location, like for example, within the cervix or inside the cesarean section scar.
Oh, okay. I remember during back in when I was an intern, meron isa full-term pregnancy. Ibig sabihin ng full-term talagang nakompleto po yung 9 months ng baby. And then, during the time of delivery, doktora wala siya dun sa reproductive area. Nasa loob siya kasama ng mga intestines.
Oh, yeah.
And surprisingly, dapat nalaman na yun ahead of time, di ba? Pero, so, ibig sabihin, ectopic pregnancy can happen pala anywhere else.
Yes.
But not in the uterus. Okay?
Yes, not in it.
Yun yung definition niya. Pero what is the main cause of ectopic pregnancy? I understand, na-mention nyo kanina, kasi usually dun magta-travel from the fallopian tube pababa, diba?
Yes.
So kung may blockage doon.
Yes.
However, ano pa po yung ibang pwedeng causes bakit nagkaka-ectopic?
Okay. The major contributing factor to getting an ectopic pregnancy is salpingitis o yung tinatawag nating, it's damage to the fallopian tubes, okay? So, paano magkakaroon ng damage to the fallopian tubes? Number 1, infection, okay? If you've had a previous pelvic infection, like for example, by gonorrhea, by a chlamydia, or any other sexually transmitted infections, that infection can go up from the vagina, okay? Go towards the uterus, and then eventually it will reach the fallopian tubes and it will damage the fallopian tubes.
I see.
Now, there are also other conditions that can cause inflammation of the fallopian tube. Yung tinatawag natin na secondary inflammation. It can be caused by endometriosis, if you've had appendicitis. Also, if you've had previous pelvic surgery, that can also cause inflammation of the fallopian tube. What happens with inflammation is that the folds of the inside of the fallopian tube agglutinates o nagdidikit-dikit, So it narrows the passageway, kikitid yung daanan. So the small sperm can pass through the narrow fallopian tube, but the bigger fertilized egg gets trapped. So that will be the cause of an ectopic pregnancy. Another possible etiology is hormonal imbalance.
Okay.
They say that high circulating levels of estrogen and progesterone can alter or change the motility or contractility of the fallopian tube. So that can also increase your chance of an ectopic pregnancy.
So this can really be multifactorial pala, Doktora. But how do you diagnose ectopic pregnancy? And usually, clinical ba ito? Sabihin upon coming of the patient to your clinic? Or usually kasi ER, Kung kunyari may pain, ganito ba, Doktora? Or what is the most common scenario when you deal with ectopic pregnancy?
Well, if you have a positive pregnancy test and your doctor is suspecting you have an ectopic pregnancy, your doctor can do a pelvic exam. Pwede kang examinin. Pangalawa, she can ask for a laboratory test to check your beta-HCG or your progesterone levels. Also, she can request for a transvaginal ultrasound. Now, the beta-HCG, it's the hormone of the pregnancy. Well, it's the pregnancy hormone.
Yeah.
Okay, it's supposed to double every 48 hours. Okay, kapag hindi natin nakikita yung normal na pagdoble nitong beta-HCG, we start thinking, this might not be a healthy pregnancy. Okay? So we're thinking, dalawa lang yan. It might be a miscarriage or it can be an ectopic pregnancy. Okay, now progesterone, it's also a hormone. Ito namang hormone na to, it's naturally high during the pregnancy. Now again, if they measure it and it's low, again, we start suspecting you might not have a healthy pregnancy. And then the ultrasound, your doctor will request that to directly visualize where the pregnancy is. Is it inside the uterus? Is it somewhere else?
Okay, but why will the OBGYN suspect that it's actually an ectopic pregnancy that's happening to sa patient? Yeah. Usually, ano po yung presentation ng mga patients? A pain or what other signs or symptoms?
Okay, initially, sa umpisa, parehas ang nararamdaman ng babae na mayroong ectopic pregnancy at ang babae na may normal
So, ito
pregnancy.
yung parang paglilihi na stage.
Yeah,
Okay.
initially.
So, whether yung normal pregnancy and the ectopic one.
Yes, they both will have a missed period, they will have breast tenderness, they can feel nausea and vomiting, and also both of them can experience vaginal spotting or bleeding, mild cramping or mild abdominal pain on one side of the abdomen. So parehas sila. So it's hard to differentiate between the two at the early stage. But as the ectopic pregnancy is getting bigger, okay, the patient may present with more serious symptoms. Okay, like for example, if the ectopic pregnancy ruptured, she will suddenly have severe abdominal pain. Also, she can experience yung shoulder pain. Okay, now what is shoulder pain? Well, when the blood is pooling inside the abdominal cavity, the diaphragm gets irritated. So this will manifest as shoulder pain. Okay? And also, she can have, with sudden severe blood loss, she can also experience dizziness, weakness, and also they may faint. Okay, they may pass out.
But if in the case that there's bleeding, usually how long does it last?
Okay, with vaginal, majority of women with ectopic pregnancy will miss their period. Okay, they will miss their period on the date that it's supposed to come. All right, but they will experience one or more episode of vaginal bleeding. Okay, that may be characterized as spotting or maybe as heavy as their menstrual period. So that bleeding can last until the ectopic pregnancy will resolve.
I see. And usually upon coming in the ER, kung kunyari, parang complaining of like some signs or symptoms, how do you diagnose ectopic pregnancy? What are the different lab or ancillary measures that you request?
Okay, well, most of the time when they come in, it's a pelvic exam, a transvaginal ultrasound, a serum beta HCG test, so we can correlate it with our transvaginal ultrasound findings, and also I think a blood count. Okay, just to make sure that, you know, she's not bleeding inside and her blood count is still stable.
In your practice, Doktora, usually mga ilang buwan na, okay, when nagko-complain na, kasi usually hindi naman lahat, minsan unaware nga sila that a female individual is pregnant, okay?
Yes.
And kapag meron ng mga manifestations and signs and symptoms, during at what month, okay? So mas nafe-feel ng patients yung mga manifestations.
Okay, well, manifestations for ectopic pregnancy can be felt between 6 to 16 weeks, you know?
6 to 16 weeks.
Yes.
That's like 1.5 months to 4 months.
The 16 weeks depends kasi, well, depends where the ectopic pregnancy implicated. Yes. Like for example, it's at the yung opening ng fallopian tube, that's a bigger space. So it can expand a little more.
That can delay the
Yes.
manifestations.
Yes, kaya it can be up until 16 weeks. Or like you said, the case you had earlier, abdominal pregnancy.
It has reached full term.
Well, there are times that they don't really reach full term because for sure the patient will manifest with symptoms. And also since pregnant siya, her doctor will probably look for the pregnancy where the pregnancy is located.
So that will be dangerous already.
Definitely.
Yeah, I mean, how dangerous is this?
Okay, the danger with ectopic pregnancy comes from the blood loss. Okay, because the fallopian tube, the cervix, these locations are not readily expand. They don't readily expand to accommodate the growing pregnancy. When the ectopic pregnancy is growing, it will rupture. With rupture, there will be severe blood loss. And if left untreated, this can be life-threatening. So the danger is severe blood loss from the ruptured ectopic
I
pregnancy.
see. So, of course, definitely, we do not want na umabot pa tayo dito sa magkakaroon ng rupture.
Yes.
And because of that, once diagnosed, what do you do right away?
Okay, the treatment options for ectopic pregnancy are two. You can have medical management or you can have surgical management. With medical management, what we use is this drug called methotrexate. Methotrexate, ginagamit yan sa cancer treatment. Yeah, what this drug does is that it kills or it stops the development of the cells. So it will end the pregnancy. Now, the pregnancy will gradually be absorbed by the body within the span of 4 to 6 weeks. Okay, so surgery will be not necessary. Hindi na kinakailangang buksan para tanggalin ang fallopian tube. That's medical management. Now, for surgical management, we do this mostly for patients na hindi good candidates for methotrexate or medical management. So one way to do it is the laparoscopy. Laparoscopy is when you have small incisions in your abdomen and then they insert a viewing tube with a lighted camera, parang telescope. Ipapasok doon para makita natin yung abdominal cavity. Now, we can locate where the ectopic pregnancy is. And then when you see it, we can actually do surgical removal. Okay? So the surgical removal, you can actually take out the whole fallopian tube, you can take a portion of it, or you can cut a small incision and then suction out the ectopic pregnancy. Now that's laparoscopy. If, for example, you have a ruptured ectopic pregnancy, you may have to do a laparotomy. A laparotomy is when you have a bigger incision. Mas malaki. Yes, mas malaki. It's so we can evacuate all of the blood that has ruptured, that has spilled into the abdominal cavity.
Okay, and what are the complications that we fear, no, from an ectopic pregnancy? Is it true na talagang mas mahirap na magbuntis after having had ectopic pregnancy? Kasi during my practice from that, I would really encounter the same patient having ectopic pregnancy, parang another ectopic pregnancy after another and then another, and minsan actually yung kakilala ko nga OBGYN pa siya eh. So why is this happening?
Well, I would say that the conception rate for someone who's had ectopic pregnancy is pretty high then naman. 60% of the time they can get pregnant again. But the thing is, they have a higher chance of getting another ectopic pregnancy.
Why?
So like 25% of the time. Well, probably, like we talked about earlier, a previous pelvic surgery, a previous surgery on the fallopian tube, is a risk factor for an ectopic pregnancy. So they had that. They had a previous surgery, they had surgery in their fallopian tubes, and this will increase
The risk.
no, yeah,
Okay,
the risk, yes.
Having another ectopic pregnancy. Naku, teka, ang dami na nating natututunan dito, Doktora. No? Thank you. Pero yun, mga kasambahay, we've already learned a lot about ectopic pregnancy. Later, we'll be delving deeper into the condition to learn about the treatment options. So, wag po ililipat ng channel, mga kasambahay. Dr. Sam TV will be right back. Welcome back, mga kasambahay! At para po sa mas malawak pa na kaalaman patungkol sa ectopic pregnancy, kasama pa rin po natin si Dr. KATRINA Tan from Makati Medical Center. And ito, Doktora, kanina dami na natin napag-usapan tungkol sa ectopic pregnancy, yung sanhi, mga risk factors, okay? And actually, we have touched a bit dun sa treatment options, no? But sabi mo nga, medically or surgically, and then meron kang mga naibigay na pwedeng different approaches, okay, when we talk about surgical intervention para sa ectopic pregnancy. And ito, Doktora, gusto ko lang balikan, for example, dun sa medical management, you mentioned about methotrexate, okay? So, usually po, kasi diba, in a normal pregnancy, usually para mag-full term, 9 months. Now, sa ectopic pregnancy, para gusto na natin siyang i-dissolve, just like what you mentioned, no? How long po yung pagbigay nito bago po totally maitanggal sa katawan yung yung fetus, okay, na hindi rin naman mabubuhay because parang it's located actually dun sa abnormal location.
Yeah. Well, with methotrexate, it can take a couple of weeks, okay? Kasi what happens sa methotrexate is, bago siya ibigay, okay, magpapagawa ng laboratorio yung doktor, okay? Initially, a beta-HCG. Aalamin kung nasan yung beta-HCG level mo. Tapos also, may mga papagawang laboratorio to check how your organ function is. Okay, now, if all of those things are normal, okay, bibigay yung methotrexate by injection, 1 dose only. Okay? Now, afterwards, i-measure continuously, okay, serially, yung beta-HCG. If, for example, your beta-HCG does not go down enough, okay, your doctor might, decide to give you another dose. Okay, and then afterwards, again, serial monitoring of the beta-HCG until the beta-HCG level is undetected in your blood.
Meaning, there's absence of pregnancy anymore.
Yes, and then that's when you stop the monitoring. So it will take a couple of weeks.
How about the side effects from methotrexate?
Okay, there are no known long-term side effects for methotrexate, but the short-term side effects naman are few. Okay, so you may experience vaginal bleeding, abdominal pain. You can also feel nauseous, you may be dizzy, there might be diarrhea. Okay, there are also serious complications, but they are very, very rare.
But have you encountered patients who would opt for a surgical intervention rather than this methotrexate administration?
Okay, well, with methotrexate injection, there's a specific set of criteria to decide whether whether a patient is a good candidate for it. Okay, so the number one important thing is that this patient will be able to follow up. Dapat makakapag-follow up yan to perform the beta-HCG test to see how she's responding to the treatment. So if a patient cannot do that, alam niya sa sarili niya, Doc, I might not be able to do that. Okay, then she is not a good candidate.
But as well, surgical ang approach.
Yes.
Okay, and then dito sa surgery, Doktora, how's the recuperation of the patient? I mean, kung ruptured naman, and then if it has ruptured already.
Okay, most women would stay admitted after surgeries for only a couple of days, okay? But, full recovery will usually last 4 to 6 weeks. Now, comparing a laparotomy with a laparoscopy. Ang laparotomy, the one with the big incision, yung malaki yung hiwa, yung laparotomy, the patient will stay admitted probably 2 to 3 days in the hospital, and then she can go back to work 2 weeks or 6 weeks, 2 to 4 weeks after surgery. Okay, depending kung ano yung klase na activity na ginagawa niya sa trabaho niya. Now, with the laparoscopy, because the laparoscopy is yung surgery na maliit yung hiwa, the discharge we will be able to discharge this patient a little earlier, and also recovery may be faster.
I see. And so mas maganda talaga hindi mangyari itong ectopic pregnancy. But kaya lang kasi, how would you know na paano mapipigilan to when actually it's secondary, pwede kasi may anatomical defect, di ba?
Yes.
O kaya parang sabi niyo kayo na secondary from a surgical procedure prior, okay? That could be like years back pa, pwede rin yun, di ba?
Yes.
So pero, ano yung mga pwedeng preventive measure na pwede natin i-share sa ating viewers?
Sadly, there's nothing you can do there are no preventive measures, Kasi sometimes nga, there are cases na you don't really know what the apparent reason is for the ectopic pregnancy. But, there are actually ways to decrease the risk. Okay? So, ano yung mga yon? First, try to limit your sexual partners. Okay? If you limit your sexual partners, you lower the risk na you might get a sexually transmitted infection. Next, if you engage in sexual activity, you may use a condom. A condom will protect you from sexually transmitted infections. So also, walang pelvic infection, walang damage to the fallopian tubes. Oh, I forgot to mention a while ago, cigarette smoking may also is a risk factor for ectopic pregnancy. So if you are smoking, quit. If you are already smoking, quit before you try to get pregnant. Bago ka magbuntis.
Yeah, because ang dami ring complications sa mga bata, sa babies, di ba? Okay, so anyways, doktora, ito, how about like after the surgery? And then, the chances of getting pregnant again, and probably siguro yung gusto ko, mas maganda itanong ko muna, usually kailan ulit pwede mag-resume back to the normal menstrual cycle ang isang babae na ectopic pregnancy?
You might get your menses, 4 to 6 weeks after the surgery.
And then of course, so it depends na rin sa maging sexual activity kung mahirapan ba pagbuntis or easier or just the same?
Well, the conception rate is around 60%, okay, after an ectopic pregnancy. But again, you have a higher risk of getting an ectopic again. So dapat, doon sa susunod na pagbubuntis, maaga magpapatingin sa doktor. Kasi alam na nga natin na pwedeng
history ka na doon
So,
okay, how about lifestyle habits of the patient? I mean, after surgery, ng isang may ectopic pregnancy, what can you recommend sa ating mga viewers?
So what do they do after surgery? Well, after surgery, I suggest they avoid muna strenuous activities. Okay, try to rest. Kahit na you feel like you're feeling better already, try to rest maybe for a week after surgery. Ask for support, ask for people to help you out with your chores. Avoid lifting heavy objects, usually walang above 10 pounds. Tapos, this is not to strain your stitches.
Para magbihis, magmas. Okay.
Tapos driving, maybe try to avoid driving mga a week after surgery. Maybe when you're more comfortable with the pain, okay, tsaka na lang. Okay. And also, avoid exercising. And sexual activity, wag muna right away.
So, kailan pwede mag-resume ng sexual activity?
Maybe when the patient is more comfortable. And I'd say kapag wala na yung pain niya.
Okay, and which is roughly?
Maybe 4 to 6 weeks. Because full recovery will probably take 4 to 6 weeks.
I see. Okay, thank you very much, Doctora. That's really comprehensive, And thank you very much. And you might want to invite our viewers to, visit you here at Makati Med and, dito sa Department of OBGYN, what do you have to offer here?
Okay. So, sa mga pasyente na, not only for pregnant women, you can come visit your obstetrician gynecologists here in Makati Medical Center, okay? For any concerns, if you are pregnant, you want to confirm if you have an ectopic pregnancy, sa mga concerns nyo na gynecologic, you can come visit.
Or wellness checkup probably.
Yeah, wellness checkup. Even women checkup, ginagawa namin yan.
Yes, and thank you very much again, Dr. KATRINA Tan from Makati Medical Center. We look forward to having you back here at Dr. Zonzi.
Thank you, Doc Sarah.
Yeah.
Thank you, everyone.
Okay, ito mga kasambahay, we hope we now have a better understanding of what ectopic pregnancy is, what it's like to live with a condition, and what the future might hold for those who have been diagnosed with it. Always remember, mga kasambahay, don't hesitate to seek medical attention right away. But before this program ends, Let's take a short break. Doctors on TV will be right back. Welcome back mga kasambahay! And of course, I would like to greet my chikiti, si Iyo and si Iya. Hi to EJ and of course kay Dr. Alain Barba-Cabodil. And syempre yung mga pasyente natin sa Barba-Cabodil Holistic Health yung binabati rin natin. I love you and miss you both, nanay and tatay. Thank you po mga kasambahay for being with us for today's episode. Hoping to see you all again next week, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic Acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend, and Acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.